From the thymus to the lymph nodes, the immune system is an incredibly important part of our body. This system, also known as the lymphatic system, is essentially a series of clumps of lymphatic tissue spread around, responsible for destroying any antigens, harmful particles which cling to bacterial/viral invaders that enter your body. The immune system, however, is not just one big clump of tissue. It can be separated into two factions based on their characteristics. These two groups are the innate and the adaptive immune systems. The innate half of this duo is made up of the parts of your immune system that you were born with. These are usually organs, such as the skin, which prevents harmful agents from entering your body in the first place, the thymus, this lymphatic organ can be found at the front of your trachea, and is responsible for training the white blood cells, so that they're able to distinguish from enemy and friendly cells when fighting infection in the body. The spleen, which helps filter pathogens out of your blood using a specialized tissue known as white pulp, which is composed mainly of white blood cells. It also uses red pulp to remove damaged blood cells from your bloodstream, as well as store platelets. The bone marrow, which not only lends flexibility to your skeletal system as a whole, but helps produce white and red blood cells as well as platelets, through a substance known as red bone marrow. Yellow bone marrow also exists and helps produce cartilage and bone. Your tonsils and adenoids, which are located in the back of your throat and in your nasal cavity. These produce antibodies which latch onto antigens, aiding their destruction. Lymph/lymph nodes. Lymph, which is essentially drainage from all of your tissues, is everywhere in your body. Thus, it must be drained through lymph channels into lymph nodes, drains full of stored bacteria-destroying white blood cells, which help kill any antigens found in the lymph. Of course, while these components of the lymphatic system are some of the most important, there are many other components of this enormous system, such as the cilia at the back of your throat or your saliva. But just for the sake of time, we'll stick to these basic organs. Alright, on to the adaptive immune system. This part is mainly composed of leukocytes, or white blood cells, which are capable of adapting to fight certain diseases. Leukocytes can be classified into two basic categories: phagocytes and lymphocytes. Phagocytes are the cells that attack any invaders, chewing them up and destroying them. Lymphocytes, on the other hand, are the cells that recognize previous invaders and help the body destroy them. Lymphocytes, in turn, can be separated into two additional categories: B cells and T cells. Once lymphocytes have been produced in the bone marrow, they either mature into B cells and leave for duty, or they leave to the thymus, where they eventually become T cells. B cells are sort of the intelligence system of the human body. When an invader enters, B cells are responsible for recognizing the invader and sending a signal to the T cells, which converge on the target, obliterating it. The immune system also uses white blood cells to deliberately inflame the tissues around the infected area to thin out blood vessels, allowing white blood cells to get where they want to go faster. Now, to have a basic understanding of the immune system, it's time to start thinking about form follows function, or why certain parts of the immune system are constructed and positioned the way they are. For the most part, it's pretty self-explanatory. Since illnesses could strike at any part of the body, the immune system is everywhere in our bodies, which allows us to be ready and on-site for any bacterial or viral infection. The different storage and development areas for white blood cells also allow it to produce leukocytes whenever and wherever it needs them quickly and efficiently. The immune system also works with the integumentary system to provide protection for the body, and the circulatory system, which provides transport for the white blood cells and antibodies. The muscular system also helps out by slowing down bacteria entering the body, and by helping move the lymphatic fluid around. The respiratory system provides oxygen to keep the body and the immune system going, while the immune system's fluids help balance out the lungs. On the other hand, the skeletal system contributes by creating white and red blood cells, as mentioned previously. The nervous system helps out by sending signals to the rest of your body when you experience pain, to let your systems know where to find the possible infections. But what happens if the immune system fails? One of the most common ailments responsible for immune system failure is the infamous illness known as AIDS, or acquired immune deficiency syndrome. This syndrome starts off as a viral infection from a disease known as HIV, or human immunodeficiency virus, which slowly destroys the T cells in our bodies. The first stage of the HIV infection is mostly characterized by a fever, in addition to headaches, a sore throat, fatigue, chills, muscle pain, swollen glands, cough, and chest pains. These symptoms usually show up 2 to 4 weeks after initial exposure to the HIV virus. Sometimes a patient will only show the above symptoms for a few days, they get better. However, they are still contagious, which makes them highly dangerous. After the initial illness, the infected party enters a stage known as latency, where a lack of symptoms occur. This period can last up to 8 to 10 years. If not treated, results in chronic HIV. During chronic HIV infection, the infected experiences a renewal of symptoms, which can include, but are not limited to, coughing/breathing problems, weight loss, diarrhea, fatigue, and once more a high fever. If the HIV still goes untreated, then the illness progresses to the final stage, AIDS. If the HIV infection is caught early, however, then the recommended remedies would be a series of antiretroviral antibiotics, which are essentially suppressing agents aimed directly at suppressing certain parts of the HIV infection. At this early stage, your respiratory system is affected by the pneumonia-like symptoms, your nervous system is affected by the fever, and your lymphatic system is affected by the swelling caused by the lymphocytes. If the infection is caught in the middle, then the treatment should be the same. But the treatment can also be supplemented by normal antibiotics to combat the infections from the beginning signs for AIDS, as well as oxygen to aid breathing, and, since HIV and AIDS are sometimes characterized by weight loss, the patient can be put on nutritional support since the metabolism is fighting the infection. During the second stage, pretty much the same systems are affected, except that the digestive system is an additional casualty, due to the nausea that accompanies the various infections and the increase in metabolism necessary to fight the infection. Finally, in the final stage of the infection, all treatments are exactly the same, except for the added unpredictability. Due to the fact that AIDS is taking control, you're now susceptible to more disease, due to the systematic destruction of your T cells. Thus, you should be prepared to stifle whatever symptoms appear. If you start to get hints of pneumonia, then get oxygen. If you start to lose weight, get on nutritional support, etc. In this stage, all of your systems could be affected, or only a few, due to the unpredictability of what infection you will catch next. In other words, if left unchecked, then AIDS could, in theory, affect all of the systems we have studied. It certainly affects the respiratory system and integumentary because of pneumocystis. This disease is often one of the first diseases to be contracted, a strain of pneumonia, and Kaposi's sarcoma, which affects the integumentary system by causing tumors on the skin. Meningitis can affect the nervous system, while other viral and fungal infections can target the circulatory and pretty much all of the systems of the body, which could, after a while, result in death.